Hello and welcome to Exam 2, Version 1, and I will continue on. This is Part 2 with the lecture. I want to go on and start looking at the learning objectives of describe the function and purpose of the healthcare agencies outlined in the chapter. I want to make sure you guys understand. Look at the difference. You have, some people call them general hospitals, and then you have specialty hospitals, you have long-term care hospitals, and then you have short-term hospitals. Okay, so I want you to know that hospitals are classified by services they provide as well as by their ownership. General hospitals admit clients requiring a variety of services like medical, surgical, obstetrics, pediatrics, and psychiatric services. Okay, you have acute care or short-term hospitals provide assistance to clients whose illness and need for hospitalizations are relatively short-term, such as several days. Okay, this does not describe like a specialty hospital. I just want to make sure that I explain that. Okay. I also wanted to add on to extended care facilities because they provide care for clients who require rehabilitation and custodial care after discharge from acute care hospital. Please be mindful of assisted living facilities, okay, because they do offer meals, laundry service, nursing care, transportation, and social activities to residents who are able to live relatively independent. So assisted living facilities, they are intended to meet the needs of people who are unable to remain at home, but they do not require hospital or nursing home care. Please don't forget about the daycare centers. We do have a gerontology rotation, and our students do go to daycare centers. They provide care and nutrition for adults who cannot be left at home alone, but do not need to be in an institution. Okay, these centers, they offer and provide care involving like socialization, exercise program, and stimulation. Some even provide counseling and physical therapy. It just depends on the daycare center that you go to. I'm aware that the daycare center that we go to, called Care Connexus, there are nurses who are employed there, and they do give medications, they do treatment, and also counseling. I spoke of palliative care earlier, but I didn't touch on hospice care. So just know that when we're talking about hospice, it's the central concept of hospice movement. It is not saving life, but improving or maintaining the quality of life until death. That's very important to know, okay? Because hospice care provide a variety of services given to the terminally ill, their families, and support persons. So when patients are on hospice, the care can be in different places. It can be in their home or in a hospital, a skilled nursing facility, so it just varies. I know in one of the objectives is to describe the functions and purpose of healthcare agencies outlined in a chapter, but I want you to focus on knowing what a case manager role is, an occupational therapist, a physical therapist, and then also the term paramedical technologist. As nurses, I want you guys to be aware of you will encounter all types of patients, including the homeless. And when we have that opportunity to evaluate the homeless, make sure that, one of our priorities is safety. And safety includes susceptibility, oh my goodness, to infection. So we want to make sure that when we do our assessment, we want to include signs and symptoms that would alert us to, hey, this patient may have an infection going on. As I was thinking, we didn't talk much about managed care and differentiated practice. So managed care describes a healthcare system whose goals are to provide cost-effective, quality care that focuses on decreased cost and improved outcome for groups of clients. And that's what I do at work. Also, we have differentiated practice. That is a system in which the best possible use of nursing personnel is based on their educational preparation and resultant skill sets. And then also, we all know what patient-focused care, that is a delivery model that brings all services and care providers to the client. When you continue to read, I want you to focus, not focus, but please know the difference between team nursing and then also between, I just spoke of it, differentiated practice, okay? So please understand those two and know the difference. I know we're in nursing to provide care, but I do want to make sure that you guys were aware of the Medicare Amendment to Social Security Act provided by a national and state health insurance program for older adults. Remember the age, older adults? So by the mid-1970s, virtually everyone over 65 years of age was protected by hospital insurance under Part A. In 1988, Congress expanded Medicare to include extremely expensive hospital care, kind of quote-unquote called catastrophic care, and expensive drugs. I just wanted you guys to be aware of that. So when we are talking to patients and they have concerns about, the cost and everything, we can kind of speak to it a little bit. And you can read more about that in your book. And this is regarding the learning outcome, compare various systems of payment for healthcare services. As you guys know, I support nursing and I enjoy nursing. So one of the specialties out there is our nurse practitioners. So for those who want to become a nurse practitioner, and for all of us, just know like what happened to get them going, or that opportunity to become a nurse practitioner. In 1978, the Rural Health Clinics Act, they provided for the development of health care in medically underserved rural areas. So this act opened the door for nurse practitioners to provide primary care. Yay! So which is a very good thing. Now I spoke on Medicare, but also I wanted you to know about Medicaid. It provides service to people who require financial assistance for health care. This is not the legislation described. Sorry that cut me off, but let's keep going. Make sure that you are aware of the Affordable Care Act, okay? I think that is describe frameworks for delivery. No, where's my nursing objective for that one? And I can't find it, but I do want you to know about the Affordable Care Act. And when I say no, just read on the Affordable Care Act. And then, if you were doing patient teaching, what would you say to patients regarding the Affordable Care Act so they can be more informed? Let's talk a little bit about HMOs and PPOs. They kind of confused me initially, so I just want to make sure I explain this correctly so you can explain to patients if you would need to. So HMO plans emphasize wellness, and members choose a primary care provider who evaluates their health status and coordinates their care. Clients are limited to their ability to select care providers and services, but available services are minimum and predetermined costs to the client. Now you have PPOs. PPOs consist of a group of physicians that provide an insurance company or employer with health service at a discounted rate. One advantage of the PPO is that it provides clients with a choice of health care providers and services. And what I just spoke of related to learning objective, describe frameworks for the delivery of nursing care. In class, we talked about this learning outcome, describe the factors that affect healthcare delivery. Make sure that you read on that and understand those factors. They're very important. Now, we talked about the healthcare goals for Healthy People 2020. So what I wanted to reinforce that the federal government funded Healthy People 2020, and it has one of its primary goals, and you guys know, promoting health and quality of life across the lifespan. Okay, the federal government also primary goal is achieving health equity and eliminating health disparities. So I wanted to make sure you guys were aware of that. Also that it also has one of its primary goals as creating a healthy environment for everyone. And also the primary goals is for increasing quality and years of healthy life. You can find further readings of that, but that's what I wanted to focus on when I was talking about Healthy People 2020. Under your learning objective, describe the function and purpose of healthcare agencies outlined in this your chapter. Please read on home health and know what they can do and probably what they won't do, or what you will not see in the home settings. Please know what forensic nursing is and what it all covers. It is a growing profession, and I would like for you guys to all read on that and understand it and know what it covers and what that nurse can do and what it provides. As we're learning in our clinical environment, some of us may be approached, or not approached, but experience or be involved with a patient who has or who's having a seizure. I want to make sure you understand our role as registered nurses. What we do is we should include where the client, with our documentation, we should include where the client was when the seizure occurred. We should make sure that we document how long the seizure was, and make sure that we document the status of the airway, which is very important, and if we used any oxygen on the patient. Now let's switch roles. I want to talk to you guys a little bit about some legal things. I want you to know what gross negligence is. It involves extreme lack of knowledge, skill, or decision making that the person clearly should have known will put others at risk for harm. Okay. Also, I want you guys to know about HIPAA. I tell you guys always, when we leave a computer, we sign completely off. We don't minimize the screen. Okay, so accessing a computer documentation system with a password, that demonstrates HIPAA compliance, correct? So just know what gross negligence is and understand what HIPAA is. Let's talk a little bit about the code of ethics. That's one of your clinical objectives. So know when you're speaking about the code of ethics, you're speaking about when you're providing care. Say you guys are student nurses, or the nurse, should focus on safety, right? Client safety. Also, we should focus on confidentiality, part of our ethics. And then also, we should ensure professionalism at all times. Please remember that our nurses' professional values are acquired during socialization into nursing from code of ethics, nursing experiences, teachers, and peers. Don't forget about our Healthy People 2020. Remember the 4 our overarching goals. I spoke on those in class. I'm going to repeat it right now. The 4 overarching goals are increase quality and years of life. Make sure you know an example of that and understand it. Number 2, achieve high quality and eliminate health disparities. 3, create healthy environments for everyone. And 4, promote health and quality life across the lifespan. Now try and think about those and try and give yourself an example so you'll understand what the first one means. You'll understand what the second one means. Okay? Alrighty. You have another outcome that says, explain the relationship of individuality and holism in nursing practice. So and that's on page 244. I want you guys to know the difference. I want you to know that in individualized care context, the nurse becomes acquainted with the client as an individual, referring to total care principles and using those principles that apply to this person at this time. Now you also have, there's one more, there's in total care context. The nurse considers all the principles and areas that apply when taking care of any client of that age and condition. Any client of that age and condition. And then you have another one, it's called person self-identity. And just know that it's part of the individual's health dimensions of any one client. You have another learning outcome that says identify common potential hazards throughout the lifespan. So when I say throughout the lifespans, I'm speaking of different age groups. So we already know, or if you don't know, I'll just explain it. Suffocation is a hazard in newborns and infants, true. And then drowning and poisoning are seen in toddler age clients or patients. That is very true. Falls, burns, and pedestrians and motor vehicle crashes are safety hazards, believe it or not, in the older adult. Thank you for listening. I'm running out of time, so this is the end of exam 2 part 2.